Hello, my name is David Fye, and I'm the Executive Director for the Kansas Behavioral Sciences Regulatory Board. And welcome to the Informational Forum for Employers in 2024. I am here with Leslie Allen, who serves as the Assistant Director for the agency and also the Licensing Manager for the BSRB. And on behalf of the agency, I just want to thank you for taking the time to attend this event. Today's event is not an official board meeting of the BSRB. Board members of the BSRB were not required to attend the employer forum, although some may have chosen to attend. The forum is not being broadcast over the BSRB YouTube channel. However, this meeting is being recorded and we'll attempt to upload it to the BSRB YouTube channel after we get done, as long as we don't experience any technical issues. The chat today has been turned off. So if you do have any questions, go ahead and please make note of those and then hold them for the end of the session today. Before we get started, given the number of attendees, I would ask when individuals are not speaking that they go ahead and mute themselves just to avoid any kind of background noises. The Employer Forum is designed as a way for us to provide updates on recent changes in the statutes, regulations, and other items related to the work of the BSRB. The Employer Forum is specifically targeted for representatives of employers in the state of Kansas that employ licensees in the professions regulated by the BSRB. Most of the time scheduled for this 1-hour Employer Forum will consist of an informational presentation. However, we will provide the time for clarification and other questions at the end of the Employer Forum. Also, we are seeking to use this opportunity today to take a step forward in connecting with you all as employers. Last year, for the first time ever, to my knowledge, the BSRB held an informational forum specifically targeted for employers of mental health professionals and to present information, answer questions, and listen to any comments. And we received a lot of positive feedback from that. So when we started the effort to invite employers to the meeting today, we used our list from last year as a base and attempted to add individuals to that list. Unfortunately, though, we know we have likely missed some employers. So for anyone watching this recording afterwards, please know these omissions were not intentional. We just look at this as a meeting as an important step in increasing communication with employers, and we hope to continue to build our list of contacts and have an even bigger group attend similar meetings like this in the future. Before we allow time for introductions from individuals attending this meeting, let me just say that outreach is very important as a goal for the BSRB. On an annual basis, Leslie Allen and I meet with groups of students at several colleges and universities. We provide presentations on the licensing path, investigations and discipline, ways professionals can be mindful of their responsibilities with their license, and also resources available for the BSRB. I'm also asked to speak at National Association meetings from time to time, and I enjoy giving these presentations on relevant topics for the profession. So with that said, if you would like us to speak to any individuals where you work at your facilities, we'd be happy to go ahead and look into providing some presentations for you all. Just please follow up with me after the informational forum, and we'll be happy to look at available dates on our calendar for presentation, either in person or by Zoom. So with those announcements and information out of the way, let's go ahead and introduce ourselves. Again, my name is David Fye. I'm the Executive Director for the Kansas Behavioral Sciences Regulatory Board. And I'll go ahead and turn it over to Leslie Allen, and she can just say a few words and introduce herself to you as well.
Good afternoon. I'm Leslie Allen, the Assistant Director and Licensing Manager with the BSRB. I'm happy to be here and meet with you all. Thank you.
And now, if there's any board members from the BSRB who are here in attendance, please feel free to go ahead and introduce yourself. And then I didn't see any enter, but there were a lot of attendees at this meeting today. We have nearly 40 people. So if there are any board members, feel free to go ahead and unmute yourself and say hello. Okay. Well, next we'll turn to any representatives from the different places of employment. You are welcome to go ahead and introduce yourself in terms of the facilities in which you are all working. If there's other attendees that are at the same place of employment as you, if you could kind of combine your introductions together or speak one after another, that way we have a good idea of all the different groups that are represented here today. So I'll just go ahead and open it up, and if individuals are comfortable doing so, I think it'd be helpful for us to get an idea of all the different employers that are represented at the forum today.
Ginger Hill from Ford County Mental Health Center.
Hi, my name's Jared Otten. I work at Health Source Integrated Solutions. I think I'm the only team member here.
Cody Sparks, Central Kansas Mental Health.
Penny
Sam,
Watson. Sorry, go ahead.
Sam Underwood. I'm with PACES as part of Wyandotte Behavioral Health Network.
And I'm Jenny Watson. I am with Family Service and Guidance Center in Topeka.
I'm Lindsay
Misty
Kroger, and I'm with
Mustang.
Sunlight. Oh, is somebody speaking over? Sorry.
Sorry. I'm Michelle. I'm with Crawford County Mental Health.
I'm Lindsay Kroger. I'm with Sunlight Children's Services.
Misty Mustang and Robert Queen with Labette Center for Mental Health Services.
Kristen Robinson with the Guidance Center.
Liz Allen with the Wyandotte Center.
Leanne Ewing and Tess Holtman with Spring River Mental Health and Wellness.
Marsha Page White and Amy Finkeldye from Burt Nash Center.
Lacey King, Ford County Mental Health Center.
Matson, Kansas Mental Health and Guidance Center.
Greg Helsel, Advent Health Shawnee Mission.
Megan Merle, Pawnee Mental Health, and I think we have several other, but I can't see all of the participants. So if you're from Pawnee, speak up next, please.
Okay, any other individuals who would like to introduce themselves or their places of employment?
Luke Comark, Prairie View.
Melissa Parker with Compass Behavioral Health.
Frank Gemfy, Elizabeth Layton Center.
Okay, we did just have a couple of extra attendees log into the meeting. We're just doing brief introductions here. So if anyone has not introduced themselves yet and you'd like to go ahead and say your name and where you're from as far as your place of employment, that would be good.
My name is Taylor Manley. I'm part of the recruitment team at the Armstrong location.
Christine Deibler from Johnson County Mental Health Center. We also have Liz Worth, Lydia Longoria, and Jenny Jackson Colburn.
Well, thank you all. It's good to see you all here. Some of you I'm familiar with, and some I look forward to getting to know more in the future. But thank you all for taking your time to attend the forum. We'll go ahead and share some information today that I think will be relevant to you. And that, like I said, at the end, we will leave some time for any questions about the material we presented. Also, if you have any questions about topics unrelated to any of these topics, or if you have suggestions for future forums, we do plan to have this type of informational event for employers at least once a year, just to help provide some insight into the work the BSRB is doing, some recent changes in law, some discussions on proposed changes to regulations that would affect the different fields. So we do want to increase our level of communication and have good partners, especially if we were to request changes in statute to go before the legislature. We'd like to have the good dialogue between all of you and help understand some of your priorities and help you understand some of the discussions the board is having recently as well. So with that, I'll go ahead and share my screen here and go through some slides. And like I said at the very beginning, the chat has been turned off. So go ahead and hold your questions until the end. And then at the end, we'll go through any questions. Okay, you should be able to see a screen here with the presentation. We do have a PowerPoint we're going to be sharing today in PDF form. And so if you would like a copy of this following the forum today, I'm happy to provide that. Just send me an email and I'd be happy to send a copy to you. So this is the informational forum for employers. Today is September 27th, 2024. To frame a lot of the content that we're going to go through today, it's always helpful just to remind individuals about who the BSRB is and what we are asked to do under the state of Kansas. So the BSRB, the mission of the BSRB, in accordance with the intent of the Kansas legislature, is to protect and serve consumers of services offered by BSRB licensees through the issuance of licenses, resolution of complaints, and the creation of appropriate regulations. And that's accomplished through efficiency, fairness, and respect to all those involved. And some of the language I often stress when I look through our mission is that the BSRB, first and foremost, is a public protection agency who were created by the legislature and tasked to serve the consumers of services and to make sure that some of those vulnerable populations receive services from individuals that are appropriately educated, trained, and able to provide services in a competent way. The history of the agency. In 1980, the Kansas legislature created the BSRB by combining the existing body of the Board of Psychological Examiners and also the social work examiners, and then put those two groups together. Over the years that followed, the jurisdiction of the BSRB was expanded to include the licensure of 5 other professions, including professional counseling, master's level psychology, marriage and family therapy, addiction counseling, and behavior analysis. Rather than have a separate board for each of the different 7 professions, we are sort of like 7 agencies in one. We have one board, and it's called a composite board in some states. And so it is made up of individuals from the different professions as well as members of the public, all appointed by the governor. The composition of the board itself is in statute. And so the law does specify that on the board, there will be 2 licensed psychologists, 2 social workers, 1 marriage and family therapist, 1 professional counselor, 1 addiction counselor, 1 master's level psychologist, and then 4 members appointed by the governor to represent the public. So there are 4 public members on the board. In terms of the agency itself, the BSRB employs 12 staff members, including myself. There's an executive director, an assistant director, and licensing manager. We have licensing specialists, investigators, clerical employees, and the 12 of us do the work for the agency. In terms of the number of licensees that we oversee, there are currently nearly 16,000 permanent licenses that we oversee, and that is compared to about 12,152 just back about 9 years ago. The largest group of licensees that we oversee are social workers, and they make up about 55% of all of the licensees that we oversee. Every other month, the board has a regular board meeting, and we provide information to the board on the current count of the total different groups of licensees. So you may not be familiar with each of these different acronyms, but basically these are the different levels of permanent license that we oversee. I mentioned social workers had the most numbers right now, but this is a little snapshot to let you know where we stand today or at the beginning of the last month in terms of the number of permanent licenses under each of these different professions. In terms of licensing trends, since July of 2015, the number of permanent licenses has increased by about 30.5% from 12,152 to 15,858. And for reference, during that time, the population growth in Kansas has just been a little over 1%. In that time, also, the number of clinical licenses or the independent level of practitioner has increased from 67.7% from 3,738 clinical licensees to 6,269. And overall, the professions with the largest increases are professional counseling, social work, and behavior analysis. I mentioned this at the very beginning, but I want to stress it again. In terms of outreach, that's a function the BSRB plays, the executive director, myself, and also our assistant director and licensing manager. We speak to different groups of students and other bodies and provide information on licensing and disciplinary matters to provide a proactive approach to assist individuals before they become licensed. So if you would like a presentation to any of your groups, please reach out and we'd be happy to try to coordinate that for you. Additionally, back in the early stages of the pandemic, back in January of 2021, the agency launched a YouTube channel, and we did this to provide access to our meetings in more of a secure format. We also wanted to be able to provide more individuals the opportunity to hear the work of the board, see the different roles and the different advisory committees that the board has. since we have 7 boards in one, more or less, each of the board professions has a standing subcommittee. We call these advisory committees. The advisory committees meet every other month, and they're made up primarily of a lot of licensees in each of those different areas. And so on our YouTube channel, we broadcast not just the meetings of the board, but also the meetings of these advisory committees as well. And so since about January of 2021, we have broadcast live or uploaded afterwards about 170 meetings, and those have been viewed or streamed nearly 10,000 times. Over the course of a given calendar year prior to our YouTube channel, I have heard that we had at most 10 in-person attendees spread across the board meetings and our advisory committee meetings. Now, using the technology that we have available and broadcasting those meetings, our advisory committee meetings have about 40 views, and our board meetings have on average around 80 views. So it's really, I really feel good about putting that information out there, inviting more people to the conversation. I know the board is working very hard to update the requirements for licensure and try to modernize a lot of the processes as technology is changing and other factors are in play, and also to deal with workforce challenges right now. So really happy that we can share this information. This it's not just broadcast live, it's also available afterwards. So we also add information to the website. So if there's any specific topics people can find from the agendas of past board meetings or the agendas of past advisory committee meetings, these are good topics to go back and see presentations or hear the discussions of the board on those topics. I mentioned our website that is found at ksbsrb.ks.gov. We recently moved to a new platform under Granicus. On the website, we have changed the appearance, at least of some of the pages, but our functionality and processes and content, we've tried to ensure that those weren't disrupted. So now there's a little bit of a better ease of use for mobile users as people are transitioning from more desktop computers to laptops and more laptops to mobile devices. So there is some better functionality with our new platform for the website, but there's also the old or the past functionality that we tried to maintain. And then some of the features on the website, we do have a portal on the website so licensees can renew their licenses online and do that fairly quickly. They can also track the progress of their applications when they're applying for licensure. We have copies of forms, policies, and publications, which are all helpful for individuals. We have links to the statutes on the Revisor of Statutes website and also the regulations that are found on the Secretary of State's website. We also have proposed changes to statutes and regulations. Whenever we request changes in the form of a bill, we always post that on the website under proposed changes to statutes. And then if we have any proposed changes to regulations, we post those on the website, and then those are also noticed in the Secretary of State's publication, the Kansas Register. We not only oversee licensing for the profession, we also oversee the investigation of complaints against practitioners. So we do have complaint forms people can access or download, and then we also have a record of public disciplinary orders as a matter of public protection. We also have information on board and advisory committee meetings, as I mentioned earlier, so people can go back and review that information. Now let's get into some of the main topic for today. I wanted to go ahead and start first by providing some updates in terms of the law on some of the multi-state compacts that are relevant to the different professions that are the BSRB professions fit under. So in Kansas right now, we have joined a number of multi-state compacts. For the compacts relevant to the BSRB, there are 3 so far. There is the SIPAC compact for licensed psychologists. That was passed in 2021 as Senate Bill 170. There is also the Professional Counseling Multi-State Compact that was passed in 2023 as House Bill 2288. And then most recently, there was the Social Work Multi-State Compact, which was passed in 2024 as House Bill 2484. Concerning the SIPAC compact, this is a compact that is designed for licensed psychologists or the PhD level psychologists. It does not include master's level psychology or the independent level of that license, the licensed clinical psychotherapist. Unfortunately, they are not eligible for that compact. A psychologist state must have passed the compact legislation, and a psychologist must still hold a license in their home state to be able to get the next step in the process to participate under that compact. Psychologists that are in states that have passed the compact and that hold a home state license may apply to the SIPAC Commission for either the ability to provide telehealth services in other member states or for the ability to provide up to 30 days of in-state practice in all other compact states over the course of a year. So there are two different authorizations people can seek under SIPAC. One of the important things is that you do still need to maintain your permanent license in the state where you are living, also called the home state. And then you have to be in your home state when you're providing those teleservices under SIPAC authority to different compact states. And if approved, individuals under this compact pay the relevant fee for that authorization directly to the SIPAC Commission. As of September 2024, 42 states have passed legislation to join the SIPAC Compact, and all of those are now effective members. Sometimes states pass a law with an effective date in the future to give them time to get things ready, but now all 42 states have passed and are ready. The only states that are not yet part of the SIPAC Compact are California, Iowa, Louisiana, Massachusetts, Montana, New Mexico, New York, and Oregon. Currently, there are about 97 licensed psychologists with a Kansas home state license that have authorization to practice under SIPAC. And if you go to the SIPAC website, there's a verification portal where you can verify if someone has authorization to practice under SIPAC. You can also sort it by where those individuals have a home state or any other states where they are licensed. In joining the SIPAC Compact, this opens up the ability for our psychologists to provide teleservices into different states. But one question that we have always had is how do we track the psychologists that are actually providing services into Kansas? That was not a required part of the compact when it was first started. However, as individuals have started to renew their SIPAC authorization, the commission has begun to require people to state what states they're providing teleservices into. And so for the last 3 quarters, we have that information available. Based on analyzing that data and trying to make sure we're not doing double counting, we believe that there have been about 40 additional psychologists each quarter that are providing telepsychology services into Kansas through that SIPAC authorization. So over the course of a year, potentially there could be an extra 150 psychologists that previously were not able to provide services into Kansas that now are able to do so under the SIPAC Compact. More information on SIPAC is available at the SIPAC website, and that is, they're listed SIPAC.org. The next compact is the Professional Counseling Multi-State Compact. As I mentioned, it was passed last year. It is a brand new compact, and it's not yet operational. However, we are taking steps to work with the Compact Commission to get ready for the launch of that compact. We expect sometime next year. It is designed for the independent or clinical level of professional counselors. So in Kansas, this would count the licensed clinical professional counselors, or LCPCs, but it would not count our licensed professional counselors, the LPCs, as they are not at the clinical or independent level of licensure in Kansas. Currently, the Compact Commission has a goal for the compact to be operational sometime in 2025, and I received an update this morning that they believe that sometime maybe around August or September of next year. Under the compact, clinical professional counselor state must have passed the compact legislation, and that individual must hold a permanent license in their home state. There's some other requirements as well, but those are the 2 main ones. And then the clinical professional counselor would be able to apply to the commission once it's operational to be able to obtain something called a privilege to practice in a specific compact member state by paying a separate fee to the commission. And that fee collected by the commission would include a privilege fee that each state would be able to assess, and then also a fee to the Compact Commission that would help fund the operations of the Professional Counseling Compact. As I mentioned, it's not yet operational. A lot of the states are having discussions on what the privilege practice fee should be. But one important distinction is that under the SIPAC Compact, once you have authorization, you are able to provide services into different states under that one authorization cost. Under the multi-state Professional Counseling Compact, you would need to pay a separate fee into each of the different states that you are wishing to practice under that privilege. You could alternatively continue to have your permanent license instead, but this allows another opportunity for individuals to have assurance they are going to meet the qualifications. It should be a faster process for someone to be able to practice in that state than the traditional licensure approach. but there is a separate fee that you would have to pay to each of the states that you wish to practice in. The Compact Commission is currently in the process of building a data system and determining rules for the compact. As I discussed with SIPAC, on the website, there's a verification portal where you can log in and verify that someone has authority to practice under SIPAC. For professional counseling, if you have people who don't have a license anymore in certain states, there needs to be a way to hold that to the public that these people are authorized to provide services. So having a data system, you'll be sharing information between the states and the commission, and that will assist in being able to help the Compact Commission process those requests for a authorization more quickly. And also it will be a way for the Compact Commission to have a verification portal so you can verify if someone has authority to practice under that compact. Among other rules, a 60-hour degree is required for practice under the compact. So there is currently a rule that is out for public comment, and I think that might have just wrapped up and what it stated is that graduates with fewer hours may qualify if their state didn't require that, and their degree was attained prior to July 1st of 2023. But after July 1st of 2023, we would need all individuals who wish to practice under that to have met the other qualifications for licensure, but specifically their degree would have had to be a 60-hour degree. More information on the Counseling Compact can be found at counselingcompact.org. In terms of the Social Work Multi-State Compact, that was passed just this last legislative session during the 2024 session. That compact is designed for bachelor's, master's, or clinical level social workers. And the model language stated that at least 7 states had to pass the model language before the compact commissioners could meet and begin to determine the operating rules for the compact and work on building the data system for the compact. So earlier this year, last year, the language was finished pretty late in the spring. So only one state was able to put that before their legislature and have it passed, and that was Missouri. During the 2024 legislative session, many other states were able to bring this forward. Kansas was the 7th state to pass the compact language, and currently 22 states have passed the language. So they have met the threshold for the compact commissioners to meet. We have started to hold remote meetings, and it is anticipated that the total, I believe the total individuals or number of states will pass the compact is probably going to reach somewhere in the 30s, maybe around 35. I would anticipate as early as next year. Under the social work model, compact member states would be authorized to not only issue a single state license, which is what all states are able to do right now, but alternatively, states would be able to issue a new multi-state license. And so that would allow social workers the ability to practice either teleservices or physical in-person services in all compact member states, including where they live and other ones that have already passed the compact. And that is without paying any additional fees to those states. So contrasting this with professional counseling compact, under that one, you have to have a license in your home state and you have to pay the privilege to practice in any other states where you want to practice. Under the social work model, if you chose to get a multi-state license in your home state, you would get that one license and it would authorize you to practice where you lived, your home state, and then all other compact states once it's operational. And that's why for the social work compact, the cost of a multi-state license is going to be higher than a single state license, because what we would anticipate happening is right now the BSRB, 30% of our licensees live out of state, because historically the model has been, if you want to practice in multiple states, you would have had to get a license in several different states. These multi-state compacts are being designed to get away from that model and provide more flexibility without having to get a license in so many states. However, for agencies like the BSRB that operate on a balance of revenue, we're able to hold license fees as low as we can based on the revenue that we receive. And so if we start to lose revenue from people who live out of state because they're choosing to get a multi-state license in their home state and they let their Kansas licenses go, we need to have a way to make up for that lost revenue. Otherwise, the board would have no choice but to review the fee structure, because we need to make sure we maintain the balance. So again, these multi-state licenses, they would allow someone to practice in all the different compact states. And to do that, they would be a little bit more expensive than a traditional in-state license. According to information on the Social Work Compact website, one of the conditions of eligibility for the social workers wishing to practice under the compact is that they must pass a qualifying national exam corresponding to the category of multi-state license sought. So states can be part of the compact if they don't require that for licensure, but for the individuals who wish to practice under the compact, they still would need to pass that as a requirement for the compact. And then there's other requirements that also apply to practice under the compact. I mentioned the first meeting of the compact commissioners occurred just recently. A number of the rules of the compact will need to be worked through, including decisions about the funding for the compact, the data system for the compact, and other items. And more information about the social work compact can be found at swcompact.org. Now we're going to shift focus here, and we're going to turn to updates on regulation. And just to kind of frame this conversation, last year for the forum, I spent a fair amount of time talking about recent changes in statutes or the law. This is actually going to be talking about something under those statutes or the law, is that when a bill is enacted and becomes law, we refer to that as a statute, or Kansas Statutes Annotated, or KSA. And statutes provide a broad authority for agencies to implement the law, but statutes rarely give the full detail of how to implement every aspect of the law. So agencies have authority to create regulations to interpret the law as well. Once a regulation goes through the necessary process, it has the force and effect of law. When you see KAR, that's administrative regulations or Kansas administrative regulations. Last year, the BSRB forum focused on recent changes to statutes. So this year, we're going to focus on some of the regulations as a change of direction. Let's start with some changes to regulations that occurred in the 22 calendar year. Looking at the psychology profession, there was a few different things that were the product somewhat of some of the aspects of the pandemic. So one of the main changes that had been discussed before but was expedited because of some of the changing circumstances was the ability to get supervision not just in person, but also to be able to do that by televideo. And so the board opened that up, and now individuals have the ability to get all of their supervision hours in person or by televideo or a combination of the two. And so for the psychology profession, the definition regulation was adjusted to add a definition of direct client contact. It would also clarify what could qualify, such as televideo, and also what would not qualify for direct client contact. It also had a definition of extenuating circumstances that was added, which is a helpful term that is used sometimes when the board is trying to weigh different factors of exceptions to certain rules. Under KAR 102-1-5A, supervised experience, change was made to clarify language allowing face-to-face supervision to be either in person or by televideo, so long as confidentiality of the technology is protected, and there are still the means to have discussion, observation, and review of documentation. And language was added allowing supervision by telephone under extenuating circumstances approved by the board. Also in 102-1-5A, previous language that previously limited the use of televideo or telephonic supervision to only 1 out of every 4 sessions was removed. So not just opening it up, but previous language that limited it to a certain ratio that was removed from the regulation. For the social work profession, under KAR 102-2-1A, in the definition similar to psychology, there was a definition of direct client contact, but this was already in existence. It was just changed to reflect the changes as far as televideo and also clarify practices that would not qualify for direct client contact. One example of that would be texting. The definition of extenuating circumstances was modified to require extreme nature of an event and to clarify that the event created the inability or inadvisability of compliance. That's more of the test we're looking at when we talk about something, whether it constitutes an extenuating circumstance. Under KAR 102-2-1A, there was a definition of 1 hour that was added. I believe that there was some conversation before that time as far as what increments of time could constitute an hour. And that did specify that it could be 1 50-minute period, or it could be the combination of 2 30 or 25-minute time periods. Under KAR 102-2-8 supervision, the language was changed that 1 hour of clinical supervision for hours of direct client contact would be 1 hour for every 15 hours, replacing the previous ratio of 1 to every 20. And that is consistent with changes in the law that decreased the number of total hours from 4,000 hours down to 3,000 hours for that ratio. Under 102-2-12 LSCSW licensure requirements, for the required completion of graduate level supervised clinical practicum of professional experience, including psychotherapy and assessment, the specific requirement of not less than 350 hours of direct client contact was removed, and that is consistent with changes in law that occurred during the 2021 legislative session. Additionally, other language was updated to match changes in statute, lowering the required number of postgraduate supervised clinical social work practice experience hours for individuals seeking a clinical license from 4,000 to 3,000. And other language was added to lower the total number of postgraduate supervised clinical experience hours from 2,000 hours to 1,500 hours, and to lower the number of hours for supervisory meetings from 150 down to 100 hours. Language was also added clarifying that there should be 2 separate clinical supervision sessions per month, at least one being individual supervision. For the professional counseling profession, the definition section was adjusted to make sure that there was a good definition of semester hour, and that client contact was replaced with a new definition of direct client contact. The definition of extenuating circumstances was added, and also a definition of related field was added to that profession's regulation. Under 102-3-3, educational requirements for professional counseling, language was changed to allow applicants from non-accredited schools to meet alternative requirements for licensure if their graduate degree was in a related field. Previously, the language required that it be a degree in professional counseling. The number of hours for a practicum was specified as 280 hours and 3,000 hours, which replaced the previous totals in law of 4,000 hours and I believe 350 hours for individuals seeking a clinical license. And that was something that was changed, consistent with changes in law that happened during the 2021 legislative session. Additionally, under the educational requirements, language noting availability of a supervisor was replaced with language regarding an extenuating circumstance if an applicant wished to use an alternative supervisor. So, as I mentioned, the supervision requirements, the ability to get supervision by televideo really changed a lot of things. And so prior to this, there was more of a standard of, is a supervisor available? And there was some thought of within a certain number of miles that you would be looking to see if someone is available. Well, changing this to televideo, now you could get supervision from someone who is all the way across the state. And so really finding an exception to those requirements was changed from availability to more of an extenuating circumstance. And the extenuating circumstance definition was already in law. Under the master's level psychology profession and KAR 102-4-1A definition, there was a definition of direct client contact added, extenuating circumstances definition was modified, and a definition of 1 hour was added. Additionally, for 102-4-1A, the postgraduate supervised professional work experience, 150 hours of supervision was changed to 100 hours, and there were other modifications consistent with changes in law. For the marriage and family therapy profession, under KAR 102-5-1 definition, the definition of direct client contact in extenuating circumstances was changed. The definition of 1 hour was added, and the reference to 2,000 clock hours of postgraduate supervised experience was changed to 1,500 hours, consistent with changes in law. Under KAR 102-5-7A, professional postgrad supervised experience, changed the reference from 4,000 hours down to 3,000 hours, clarified 1 hour of supervision per 15 hours of direct client contact, and that 100 hours of supervision was required. For the addiction counseling profession, under KAR 102-7-1, the definition section was adjusted to replace the definition of direct or client contact with direct client contact, and there was a new definition of extenuating circumstances. Also added a definition of 1 hour and under direction, and added additional references to the LMAC. When the profession was first created, it was created with the LAC license and the LCAC, and the LMAC was added, and some of this was cleaned up to make sure there was clean delineation between the 3 different levels of license. Under KAR 102-7-6, professional postgrad supervised experience, similar to what you've seen before, the changes from 4,000 to 3,000 Also clarifying 1 hour for every 15 hours of direct client contact, and then replacing the 150 hours of supervision with 100. Switching next to regulation changes that occurred in 2023. The board offered a fairly large bill to the legislature requesting a lot of statutory change. Ultimately, many sections of that bill were passed in 2023, sub for Senate Bill 131. And in terms of some of the items in that bill, there were several new license types that were introduced by the board. Each of these serves a purpose in helping make sure people have a smoother path towards permanent licensure. But the statute itself sets the cap for those fees. It's the regulation that actually determines the amount under the cap. And so once the bill had passed, the board really worked hard to put forward fee updates in the regulations as quickly as possible. We could start issuing these different types of licenses. Initially, the board put forward a temporary regulation with the fees, and then followed that up with a permanent fee regulation. So the board also voted to lower the fee for most temporary licenses. Some of them before this ranged as high as $175 for some of those temporary licenses. With this adjustment, the board voted to lower them all so that they were all $50, and that was consistent across the board. Some of the new licenses that were created in that bill, temporary candidacy bachelor's or master's social work license, and these are for individuals who come from schools that are in candidacy for accreditation. The candidacy process for accreditation for social work programs can take 3 to 4 years sometimes. And so it's possible that students could come from those programs before they reach full accreditation. So if they are in candidacy, this allows them the opportunity to get a temporary license and work for a couple of years. It can also be renewed a couple of years. Once their program reaches full accreditation, they can get a permanent license. And this was modeled after something that's working very well in Minnesota. Additionally, the board created a new type of license, a 6-month temporary reinstatement license for individuals who have been out of the profession and would like to come back, but they haven't completed all of their continuing education hours to do so. They can get a special 6-month temporary license to be able to work while they finish those hours. And then once they finish those hours, they can get their license fully reinstated. Community-based licenses were also something that was added by the legislature. It is essentially an alternative to the temporary licenses. The fee the board determined should be the same as the temporary licenses. They last for up to 24 months. You have to be working at a certain type of facility and meet other requirements to get a community-based license, but the board do go ahead and put the fee for those types of licenses into the regulation. Other fee updates, the board proposed a new policy that was enacted by the legislature to decrease the cost to reinstate a license if someone had been with an expired license for more than a year. And this was really intended to help people who had really been licensed at one point, had left the profession, and now were wanting to come back and practice again. And so for those people, to entice them to come back to the profession or make it easier as a path, the board decided to lower the cost to reinstate their licenses by half. So instead of having essentially a double fee, you would only have to pay the regular renewal fee to come back and reinstate your license if it had been expired for over a year. The board also determined that there should be a $25 privilege to practice fee for psychologists practicing under SIPAC. And part of the reason for that is the SIPAC compact actually bills the state of Kansas $10 per person per year. And so at the end of each calendar year, we've been paying basically close to about $1,000 based on that assessment that SIPAC has charged the BSRB. This $25 cost is a way for us to make up that loss. And so the board had determined that that should be set at $25 every 2 years when the individual renews their license if they are practicing under SIPAC authority. Other changes to the regulations, looking at 2024, the board has recently just put forward some changes to education regulations. So for individuals who receive their education from non-accredited programs, the regulations allow an alternative path to licensure, but the program level requirements and coursework level requirements still need to be met. One of the big changes that went forward in this set of regulations adjusted the definition of in-residence. So for the social work, professional counseling, marriage and family therapy, and addiction counseling profession, the previous language required a certain amount of coursework to be obtained in the physical at the physical location of the school in the presence of core faculty. And I need to stress, this in-residence requirement was not for most of our applicants. The vast majority it did not relate to. For the social work profession, professional counseling, and marriage and family therapy, there are national accrediting bodies. And for professional counseling and social work, if someone obtained their education from one of those programs that was nationally accredited, they didn't have to meet this in-person in-residence requirement. And so this was for people who were not from an accredited program, that we could have alternative requirements to help more people get licensed. And so with the new change in place, it opened up the definition of in residence. And so now, instead of having to be physically at the location of the school in front of core faculty, it allowed an alternative. They could either be physically at the school in front of core faculty or face-to-face by screen, as long as it was synchronous in real-time video conferencing. And then for the marriage and family therapy profession, the previous language did require the in-residence condition to be met if you were from an accredited school or a non-accredited school. Now the language has been changed, so the in-residence only applies to people from non-accredited programs. Other changes for the addiction counseling profession, the national accrediting body was not identified previously. So most of our professions have a national accrediting body. Addiction counseling did not. So the board recognized in this set of regulations the National Studies Accreditation Commission as an accrediting body. So applicants attending a school accredited by NASAC no longer need to meet the alternative requirements, and we can expedite those people through the process much more easy. Also, for the addiction counseling profession, certain coursework requirements were adjusted to allow more flexibility, including modifying one of the requirements for one of the courses, which had to do with methods of individual counseling. There was previously a reference to substance use in that, and there was a thought that it would be limiting. And so changing that to biopsychosocial needs would open it up to other individuals who came from different programs. The master's level psychology profession, historically a national accrediting body did not exist for that profession either. So the regulations were changed to include removing a distinction between core faculty and other faculty concerning certain ratios in terms of those programs meeting the requirements for licensure. For other changes, the professional counseling profession, for example, applicants from non-accredited schools, the new language allows the person chairing or directing the program to have a doctoral degree in a related field. Previously, it said that someone had to have a doctoral degree in just professional counseling. And then there were various language changes to sync with new changes in law, such as the board's position that they had put forward in the bill last year to change the time frame for temporary licenses from 12 months to 24 months. So a lot of that language was syncing up with the changes in the statute. In terms of some upcoming changes to the regulations, the board has spent a fair amount of time reviewing the unprofessional conduct regulations for each of the professions, and will soon move forward with some recommended changes to that profession or those regulations. Additionally, the board has been reviewing the continuing education requirements for all professions, and there should be some upcoming changes. And additionally, the board has been looking at supervision requirements. Every individual seeking a clinical level of licensure has to have an approved agreement with the board, and you're supposed to notify the board within 45 days of making a change. The board is looking at changing that language and has recommended moving forward with a change to the regulation so that if someone didn't notify the board within the 45 days, the board would have the ability to review that to see if it would have been a change approved by the board. And so as opposed to having to deny those hours, this would allow the board some flexibility to be able to approve those just if they were not in compliance with the 45-day requirement. And I'll go ahead and just kind of end the presentation with my personal information. I've been in contact with everyone over email. I look forward to working with you all more. But I'll go ahead and end this. I'll stop sharing my screen and I'll open it up for questions. If any of you have any questions over the material that we covered today, or if you have any questions unrelated to the material, or if you have any suggestions for other topics for future forums, I'd be happy to just get some feedback and hear from all of you here today.
I do have a question.
Okay, go ahead.
Did you say that temporary licenses are now 24 months or are they still 12 months at this point?
So basically when that law went into effect, which was publication in the statute books, so that was as of July 1st of 2023, the BSRB is able to issue temporary licenses that last 24 months instead of 12 months. So there wasn't a retroactive aspect to it. If someone had a temporary license before then, it was still a 12-month temporary license. But any that were issued as of July 1st of 2023, we can now issue those for 24 months.
Thank you.
There's also some language in the statutes or regulations that allows us to provide an extension of time if someone has a temporary license, but there has been an extenuating circumstance why they were not able to take or pass the test within that time period. We do have the ability to grant an extension of time of up to 6 months. And I've been trying to be lenient, especially for people who maybe obtain their temporary license prior to us being able to offer them for 24 months. And so for any individuals to meet the threshold for that, and they do need an extension, they can just send a message to me and I can evaluate those circumstances. And if I can grant them the additional time, I'm happy to do that. I want to help as many people as possible meet the requirements for licensure. And I know not everybody is going to pass the licensing exam the first time, but want to make sure to help people out as much as we can. Any other questions about any of the topics we talked about today or anything unrelated to that? The board is meeting this weekend. They're having an out-of-town planning meeting to discuss items relevant to a legislative agenda. If you have any items or feedback you'd like me to deliver to the board, I'd be happy to kind of listen to your comments today and then communicate that back to the board. What about focusing on future forums? I do plan to have an event like this once a year, and I will definitely send out a message to each of you. Any suggestions on topics or things to add to the review in the following years? Is there anything that would be helpful for you to get a refresher on or something we didn't cover today that you think would be helpful? Well, I know that sometimes the way my mind works is as soon as the meeting ends, I think of something that I wish I would have said, or so if you do think of something after the meeting, feel free to reach out by email. I'm happy to continue the conversation. I look forward to doing that with each of you. If we don't have any additional questions today, look forward to seeing you all next year. But thank you again for spending your time here today. I hope this information was helpful, and I hope you all have a great day.
Thank you.
Thanks, everyone.
Thank you. Bye.